We're talking with board-certified plastic and reconstructive surgeon, Dr. Jeffrey Scott. Our topic today is breast surgeries. Dr. Scott, when we took the break, we had begun to discuss the reconstruction of the breast, and you had mentioned that there are a variety of techniques that you would use.
There's three primary approaches to breast reconstruction. One is to place a tissue expander underneath the mastectomy, underneath the muscle, and that is basically a deflated balloon, if you will, and then we serially inflate that to stretch out the muscle and stretch out the skin to the point we want it to ultimately be. Then we come back as a second stage and put a breast implant. So that is reconstruction with first a tissue expander followed by a breast implant. That technique is the simplest, least invasive of the breast reconstructive techniques. The disadvantage is that there is an implant there, and an implant in a reconstructed breast is different than an implant for breast enlargement because there's no native breast tissue there. So there's a little higher incidence of some distortion and that sort of thing with a breast reconstruction with an implant. Another technique is where we sort of use a combination of an implant and one's own tissue, and that's called a latissimus flap, where we actually borrow this big, broad latissimus dorsi muscle. That's the big triangular muscle of the back. We borrow that muscle and some of the overlying skin, tunnel it underneath, and bring that forward to bring in the extra skin that was removed from the mastectomy, and also bring the bulk or the mass in with the muscle. And then usually you have to put in a smaller implant underneath that. That's sort of middle of the road as far as the invasiveness of the procedure and what's involved. It has the advantage of bringing in the extra tissue from another site instead of having to stretch the tissue. So by doing that, it gives the breast sort of a natural droop or a natural amount of relaxation. And then the third, probably what I think most plastic surgeon would consider the best option if the individual is a candidate for it, is called a tram flap. And that's transverse rectus abdominis myocutaneous flap, which involves taking the muscle and the skin from the lower part of the belly, leaving it attached and then rotating it underneath to bring all that skin and fatty tissue to the breast. It's the most involved, the most invasive of the procedures, but once it's all said and done, it's generally the best result because it's all skin and fat, which is really what a breast is anyway. Can give you the natural droop, natural feel, natural look, and it's all your own tissue. So, you know, we don't have to worry about a breast implant rupturing or becoming displaced or anything like that down the road.